So welcome everyone. So if you're in the room with me, it might seem weird that I have this mic, but there's a virtual audience. And so I want to make sure that they can hear us. There's about 20 folks virtually. So I am going to use this mic, and we have another one that we will send around for those of you that are in the space. I was just in another session with Beth, and so I know where she is. Oh, speak of the angels. And then they walk in. We literally just started. Okay, so I'll give Beth a chance to get acclimated, and then we will get started. Well, we have several on virtual. So, all right, so let me introduce, I was looking for my phone to track the time, but my phone doesn't want to be found. But anyway, so I'm Isaiah Webster. I am the Senior Director for Organizational Excellence. Welcome to those of you both in the space and virtually, and I appreciate you all joining us for this breakout discussion entitled Building a More Perfect Health Department. And thank you to Beth, who is from Washington State and is NASTAD's current board chair for 12 hours, 16 hours, something like that. This session is virtual, which is why we're in this huge space, so I apologize for that, but we got the honor of being the virtual session. A little bit about why we wanted to do this session, and then we will just dive in. So when NASTAD completed its strategic plan at the beginning of 2022, we started to kind of roll out to the membership the idea of organizational excellence. What does that mean for us internally, and what does that mean for us externally? And so for the past year and a half, part of my job has been to help the organization think about what that means for us. So prior to this role, I was the director of SEBA at NASTAD, and then I moved into this role, which was brand new at the beginning of 2022. I should really say that it was really the board and Stephen really pushing to have this particular role included in our reorganization, and to really think about why it was important for us to have organizational excellence sit alongside health equities, syndemic approaches, and the health systems work that we do. Those other three pillars, as you know, are vital to NASTAD's work, and I think that those are a little bit more obvious to folks. The one thing I will say about this particular pillar of our work, two things I'll say. Number one, it's internal and external, so it involves the staff, the board, and the staff of the members. And secondly, it's not about particular job functions, it's more about the environment and the culture that people work in. And so when we're offering technical assistance for a health department staffer that's doing HIV testing, for example, or when they're a DIS, for example, that's a really clear job function and it's a clear role. And so when we go to do TA, people can see and understand what that is. But when I come and say, let's talk about the culture of your organization, or let's talk about how the wellness of the staff, that's a little bit less defined. And so it's taken a lot of time for us to get on the same page about what this is and what it isn't. I'm gonna let Beth do any type of welcome and orientation that she wants to do. And then I have some slides, there's only 5. And then we're gonna get into some discussion questions around what your challenges are about this.
Thank you. Hi, everybody. So I think, honestly, for me, these kinds of activities have actually become my primary work. I'm no longer a subject matter expert in ADAP, or certainly was never an expert in epidemiology. I'm a social worker by trade, in training, and so looking at the operations of our office and our staff has become really most of what I do a lot of the time. I think culture, the word work culture has, I don't know, I used to get that question a lot on interviews, right? What's the culture of your office? And I was like, it depends on who you ask. I mean, I can't tell you what that culture is, but I think trying to find a way to create a culture and a work environment and relationships and collaboration and communication that actually helps people thrive in their work and feel a part of the work, and not just what they do, but understanding and respecting what other people do. That sounds simple. It's really not. It's especially in a virtual world. My office is still very virtual. We don't have space to go to right now. And so I think I have, um, I have a significant amount of my time spent in this area. And I think also when I think about the operational pieces of it, specifically around contracts and hiring practices and how we recruit and retain staff. Those aren't decisions that are always left to us, right? If you're in a system, sometimes these decisions are made above you and you have to try to figure out how to make them work. But being flexible and creative and innovative with that can make change for your office as well as, at the greater level. So I've also spent a lot of time recognizing that we create a lot of our own barriers. The most recent lesson that I learned on this was when I had a new contractor politely explain to me how terrible their experience was coming into our system as a contractor and how we were slow to respond. We responded with acronyms. We let 2 weeks go by before we gave them information on what they needed. Their contract was late. Their payments were, it was just, and I was like, oh my gosh, right? What is happening? We've lost the ability to actually maintain good relationships. We've become so bureaucratic, and that creates barriers for BIPOC organizations to participate, for smaller organizations to participate. If we can't explain what we do so that someone can understand it, then no one's actually ever going to be able to really come in and work on our populations in a way that's meaningful. So I get these lessons all the time. So I'm drawn to this, and I actually feel like for my position, and probably many of you, this is where I spend an awful lot of my time. So glad to have it as a discussion.
If you're listening online, we're going to move through a very brief presentation, and then we're going to start the discussion. But at any point, if you would like to raise your hand or put a chat to us into the chat box, or even unmute and be spoken, just know that you will have an opportunity to do that. And I will periodically check with Kyle to make sure we can do that. Did everything I just say is accurate? Okay, good. I'm just making sure with Kyle that y'all can do everything I just said. Okay, so the slide that you're all looking at now just covers the 4 priority areas of NASTAD's strategic plan. I'm not going to spend any time on A, B, and C because we're here to talk about D, which is organizational excellence. This is literally just the title of my priority area, and then we're going to spend some time into what this actually is. So I wanted to give you just a little bit of guardrails around how we think about this. So I have 2 slides really. This one on the goals, and then the second slide you'll see in a second is on how we're organizing our teams around this work. So in the strategic plan, it's a 5-year plan. We're in the middle of year 2. There are 27 objectives that the organization has committed to in terms of organizational excellence. And so my primary responsibility as the leader of this work is to implement those 27 objectives with the NASTAD staff, with subject matter experts, and with the NASTAD membership, the health departments. The activities are really grouped into 3 broad goals. The first one is NASTAD staff board and its membership is making sure that it is diverse, high quality, capable, and qualified to achieve its mission. A diverse workforce is prioritized through DEI and anti-racism efforts. So whether you see a plenary at the annual meeting, whether you see documents that we produce, that very first goal is being reinforced in everything that we do, or at least that's the charge that we have based on our strategic plan. The second goal, NASTAD has a robust strategy for revenue identification, management, diversification, and utilization. So making sure that we're not solely reliant upon federal funds, but that as best we can, diversifying that funding stream. And then thirdly, NASTAD and its members have highly effective organizations focused on organizational structure, trauma-informed culture, core principles and values, financial and risk management, and highly effective governing boards. So both internally and externally. So at NASTAD, Stephen Lee, our executive director, has flattened our leadership structure. We've included more staff on the organizational leadership team intentionally. And at the board level, as you all know, the board has expanded its membership in an attempt to be more diverse and to have power sharing. And so that's taking place on both sides. And then just a little bit about, I think I may have gone in the wrong direction. Sorry, let me go back. So in terms of the teams and the way that we think about this. So we're creating 3 teams at NASTAD for the organizational excellence kind of pillar, if you will. They are capacity building, leadership development, and workforce wellness. The capacity building team is doing our core CEBA work in the Southern United States. It's funded by the CDC. And so a lot of the CEBA that we do, which is really based on our peer-to-peer TA model, is taking place through the capacity building team. Of these 3 teams, it is the oldest and most established. The second team is the leadership development team. This is where we're working on programs specifically around developing leaders and fostering their continued improvement as leaders. So the minority leadership program, or MLP, it would be really the main program on that team. And then finally, the workforce wellness team is really focused on trauma-informed approaches, staff burnout, and all the other factors that impact the work that the public health workforce does. So some of you may be familiar with the trauma-informed approaches toolkit, the rollout of that, the continued kind of tea around that, the workshops that we're having. That would be an example of the work of that team. So when you think about how we are thinking about it at NASTAD, this is how NASTAD is approaching it. Where I wanted to go with our discussion today is to talk about how the health departments are thinking about it and how you all are approaching it. And I wanted to recognize that your approaches might be different and that that's okay. And then my last kind of note here is just some discussion questions for us to noodle over, and we can use these or not use these, but I wanted to give us kind of a starting point. And I wanted to reiterate what you see here in the blue, which is that organizational excellence isn't about perfection. It's about continuous learning, and it's really about pursuing more sound, more perfect, if you will, organizations. And so if you were to ask me, how does NASTAD define it? That's how we define it. And what I'm really interested in is how you all are defining it for your organizations, for your health departments, and kind of what the challenges are. So before I open it up, Beth, did you want the talking stick back? Okay. So anyone who wants to get us started, you can either pick one of my discussion questions, or you can just kind of react to what you've heard, or why you just chose to be a part of this conversation.
I wanted to come because I feel like we were making great strides in these areas until we had a change in administration. And now we're not allowed to say racism or diversity because we could hurt white people's feelings, which is a little upsetting. To say the least. We have an Equity, Inclusion, and Action Council at the office level, which is mostly staffed by the HIV and STD folks, but we've slowly encouraged the other divisions to join us, and they do learning opportunities for staff and presentations, and really just trying to broaden everybody's mindsets about priority populations and how we can do a better job. And that has continued, and I'm happy about that. We have a trauma-informed, healing-centered approach curriculum, THICA, that we worked with Holly Hansen in Iowa to develop, and we're getting ready to launch that. Not only we've been doing some internal work around trauma-informed care, and now we're getting ready to expand it out more. And what does it really mean? Because we've been doing a lot of trainings, but then how does that become operationalized within your agency? All right, I went to the training, I understand what ACEs are, I know why this client might be acting this way, but what do we do about it? And so that's where I think we're on the verge of. I think for me, one of the challenges about organizational excellence is, as I'm getting older and I've been there for a long time, I'm having challenges around the age differences. People coming into public health now are a little bit different mindset than when I started 30 something years ago, when, HIV was a crisis. And you had to really want to be working in HIV to work in HIV. It was your calling, it was your life work. And now we have people come in, okay, there's a nice job in epidemiology, great, but then 2 years they're going to be gone. We don't have that, the long-term commitment that we used to have. So I struggle with that. And you know, the fact that staff do seem to be less happy working in state government. And I'm reflecting back on when we didn't have short-term disability, we didn't have alternate work schedules, we didn't have telework, and those are all options now. We didn't have parental leave. You got 6 weeks, you were back, even if your uterus was still hanging out. Now you get 3 months of parental leave. So I see all these changes that I think are great benefits to state government, but for young people coming in, they're just finding the next thing that they're unhappy about. And I know that's not probably accurate. I'm coming at it from a very different point of view. So just for me, it's kind of bridging that divide. I don't have their challenges with paying rent that has gotten crazy or having huge student loans. And so, yeah, I don't know their experiences. So for me, it's really trying to, how do we pull together the workforce and have people recognize the legacy of what's gone before and how much better things are, not only for us in the workplace, but for people with HIV than when I started and we didn't have a test and we didn't have a single drug. And I worry that we're going to lose some of those. We're just going to lose that history that people don't know where we have been. There's always room to improve. We can always do better. We're more diverse, all those things. But I still struggle with some of the internal politics and uncertain leadership at the health department.
Oh, no, go ahead. Did you want to respond?
Yeah, really quickly, because I did a workshop recently where I mentioned how the people who started this work used to do it out of the trunks of their cars after their jobs. And I got a lot of puzzled looks. And so I pulled the thread and I was like, you all do realize that people used to hand out condoms out of their car. That was their office after they left the job that they were getting paid for, and that they did HIV prevention work out of their homes or out of their cars. And they thought that I was making that up or embellishing it. But these were folks who were, you know, newer to their careers and newer to public health work, and they did not know that history. What you made me think of, Elaine, is how we are privileged and challenged by the fact that so many people who do this work are brought to it because it's hard work for them. Heart, not hard. And, you know, we have to just acknowledge that and work with that. It is what it is. But as the workforce shifts and changes, people are brought to it through other means. And so what does that look like now?
Hi, I'm Jessica Forsyth, and I am pronouns she, her. I'm from Colorado, also a social worker. So I took over this position at the state health department in the midst of major trauma for the team. There was a lot of lawsuits. There were, and luckily I was out of this work for a little bit. I started my career early in St. Louis and started a program for youth living with HIV. So anyway, it was a tough time, right? We had upheaval. I had a 56 item audit to get through. I really had to build back trust with the group. So I really kind of, some people are aware of this who've been around a while. Okay, anyway, there have been lots of directors that have come through. So if you've been here in NASTAD, people are like, oh, did you know this one and this one? And I was like, yeah, they're gone. So anyway, couple things that we do, and I don't think we do it all well, is we have, so I had to build back trust with the group. So it was tough because it was all virtual. So I'm starting in this new role. I had been a contractor of the state previously. I'd worked with them. I was on all so I knew the process, but I just didn't know all the work. So we do a few things that I think are somewhat helpful. We really have team agreements, and one of them, it is around cultivating trust, authentic communication, innovation and growth, which includes professional development and operational excellence. So really thinking about how we have email conventions, because I was getting so many emails that I didn't know the due date. So everyone has to put something in the email subject line with a due date on it, or if it's an FYI, or if it's an act. So we're trying to use these things, but those team agreements or community agreements, I call them, were developed by the staff. not by me, not by any leaders. It was developed by them. And then it was also, we have a trauma-informed champion group with Holly helped us with that work, that also looked at all of them. So that's one way we do things, but we also really have opportunities, I think, for any staff can request professional development at any time, and we get pinged on it and we prioritize it and we talk about it at meetings. We also have no meeting zones. But I think one of the things, even though it's a challenge for our younger staff, is that I'm committed to making sure that the highest paid person in the office, which is me, does not make more than 3 times than the lower paid person. So I have that flexibility in our state system. So we can petition HR and we have these memos where I can say, you get, I want them paid 25% above the minimum. Here's the reasons why. And I've not been turned down. And when we have staff shortages, I can also give pay differentials, which is very helpful to say someone's leaving, we have to, because they're slow to fill positions. Someone's leaving, you can get 5% for 3 months to cover that load, because it is a load and it's a difference. And I think that those kinds of standard processes really help. Yeah, I'll stop there.
Thanks for sharing.
To both of your points, I'm coming from Arizona, which is not historically the most progressive, but I feel that at the state level, our office chiefs and people in charge are really, really making an effort and working hard, and they show us, and they make monthly meetings with us just to show us like our 5 pillars of what professional development that you want to do, and they're very open to it. So I know that that is very helpful, especially I've been in social work for 10 years and I'm part of the younger generation. And you are correct, the pay is, pay, office work culture, and the ability to do remote work is, I think, our number one thing, because we have student loan debt that's unprecedented. We have rent that's unprecedented. Like, we don't even have children because we can't afford them. So we're moving around because we need more pay, and and that's the thing. And we all can't control that, so we do what we can. But I do see, like, my office chiefs and the culture that professional development, like we were saying earlier, professional development is one of the keys. I always get an email like every week from my boss saying, let me know what professional trainings that you want to go to. And that's something that I really value, especially as an up and comer and a program manager. As well as I know that they are working hard to like get us paid more, or at least like have a hiring incentives, because right now in Arizona, we have like a hiring freeze, that sometimes happens, or you have to do layoffs, just not now, but back in the days. So those things internally, is very, very helpful, and having a culture of trust that really does come from our office chiefs on the way down. Even though I work remotely, I never feel pressure or anything to be like justify my time of work. I remember when I worked at other places in public health, where every 15 minutes you have to log what you're doing if you want to work. I'm like, and as a social worker, you might spend an hour on trying to just adjust transportation, medical transportation, depending on your clients, and having that other requirement, like, I'm out of the office, I have to clock every 15 minutes. That's an added stress that does get tiring. So thank you.
I wanted to, do we have anyone online that's waiting to speak, or any comments that have come in? No. Okay, go ahead.
Also, having a succession planning and also job descriptions, and does help for new incoming employees, because that's always helpful. I've always gotten that question from my employees. So what is my actual job? What am I supposed to be doing? What am I responsible for? So that also helps.
For the jurisdictions that are in the space, both virtually and physically, I would like to hear from you, if we can, about how you, what would be your determination on the wellness of your staff? And by that, I mean, so we all work in public health, we all work in HIV, hepatitis, mostly, STDs, some of us. So there's that. And then there's like all these other epidemics that have popped up in the last couple of years. And then there's just the compounding effect of just, NASTAD was open every single day during the last 3 years. So we just kept working. And I'm wondering about the cumulative effect of a public health workforce. And at some point, if we don't just take care of ourselves, then what? So I want to know how the wellness of you and your staffs are going.
So I think during the pandemic, I lost like 75% of my staff, right, to the work of the pandemic, and I stayed in my seat with a small group of other people. But then coming back, and they all came back. I think I lost maybe 1 or 2 people to stay in the pandemic work, but I think what happened is there was this delay in the response to the burnout and we're still in it, right? I mean, we're all in it right now. And what I'm seeing is at the agency level or at my division, the division is above my office, and at the division level, they really are trying to address it. And they did have trainings and webinars and some things that we could participate in to try to recognize the burnout and the fatigue. We've been told, like, I never say no to leave. I mean, literally never say no to leave. I usually have to tell people to take their leave, and I have to tell people to log off and why are you still on? And, those kinds of things. We've taken it really seriously to try to set boundaries with people about their work. And, when you're on leave, no one reaches out, go to whoever their designee is, those kinds of things. But I believe that what I've discovered and what's been made very clear to me by my team is even with the folks who came back, we are under-resourced. I haven't really lost any staff, but I have about 30 positions that need to be created in order to get enough people to do the work, because we've realized how very under-resourced we are. And so now I'm working to try to get folks to identify who's missing, what are the gaps for you so that we can start resourcing, because the burnout, while it certainly came as a result of COVID, was actually probably there before. And we have been on a famine of support. And I regret that it took this long to realize that, but I'm actually trying to, generate new revenue options to be able to fully support my office staff. The other thing I wanted to say about the young versus those of us who are more seasoned, I'm not going to use the O word. And actually my wife is the one who told me this. And I really resisted it because I resist a lot of things that she says, but was you need a mentor, and your mentor needs to be under 30. And so I have found a staff person on my team who is dynamic, who I've known for a long time, who is a young person, who talks to me in a real, clear, honest, young way when I go, I don't understand that. And he's like, okay, well, here, we're going home. I'm going to talk to you about what this means. And so I would encourage you to find a person like that. It doesn't necessarily have to be a work person, but it's really helpful because I get a completely different perspective when I get his feedback. And it has made a difference in some of the decisions and the processes I've employed.
If you follow Laura's advice, you will go far in life. And I can say that. So Laura is Beth's wife, and Laura was my boss years ago at another job. And so I can tell you, you have to follow her advice. Other thoughts about wellness?
Just adding to that, and that's very, very good idea too. I think just we work in this field in HIV, and it's always been where the crisis people, we know how to handle crisis, we know how to handle epidemics. So we become, especially from a government standpoint, we've become like the go-to. We're having a crisis, it's a public health crisis, so you guys deal with it without any additional staff, any additional money, any administrative caps, as we said yesterday. And we're just in the social work field as well, where just like nurses and healthcare, you're expected and if you don't do what above and beyond, you're reprimanded by the community, by just everyone you know, and even patients. So it's really about, yes, great, another crisis. Okay, give it to the HIV folks or the hepatitis folks. They'll figure it out. But as we deal with more and more people, we're given the same amount of money, the same amount of staff, these same expectations, if not more. And it's great that we have AETC, we have all these resources that we didn't have 10 years ago, 20 years ago. But it doesn't make a difference when we don't have staff and the money to pay them, and then also give them healthcare as well. And then on top of that, dealing with any government issues or trainings that we don't have time for. And if we had more time, yeah, it'd be great. But I think we've become the community that if we have an epidemic or any public health crisis, they come to us and we are expected to deal with it and to do the best with what we can with the same amount as we had 20 years ago. And I think we've become okay with that. And that's not great. And I think that's a lot for the younger generation where we're saying, it's not okay and I'm not going to deal with that anymore. Like, we're not going to take it.
I really love the idea of the younger mentor, and I think I sort of done that unofficially. Someone who started out as my intern and then ended up working in another division, but she was the person I would call and say, hey, talk to me about this. Give me your perspective on that. And it really started when I got my first smartphone. And I didn't know how to operate it. And so I had all my young employees in my office showing me then you do this and you can do this. And so I really enjoyed that. It made me laugh, that interaction. And some of the wellness things we do, like during the pandemic, when everybody was so scattered, we had, some listening sessions. And then we had somebody who was kind of our, I don't know what you'd call them, our rah-rah workforce champion. She would send out inspirational messages. Now, some people hate that kind of stuff. But some people really, really love it. But then other days it might be a puzzle or a word game. I'm on the word game. I'll do the word game. So we tried to vary it so there was something for everybody, and all the managers donated prizes and things like that. So we would have drawings. And I think that did keep people engaged when we were all apart. But the whole thing about relying on the HIV STD folks when there's a crisis, all this money rolled in for COVID, and our agency would not hire anybody to handle social media. And so my poor social media person handled it by himself for a year and a half with all those horrible, horrible comments from the public that were just like, knives in your heart. And he suffered mental health crisis. And I finally said, they were sitting on millions of dollars. They wouldn't hire anybody. I'm like, he cannot do this job anymore. You've got to get him some help. They ignored us. And it was very upsetting. And, we've been penalized in some ways for things we did not achieve. Or we were told by CDC and HRSA that our staff could work on COVID. And now they're like, well, where are these outcomes? It's like, well, we were all working on COVID. And then there was we should have been putting time and effort. We should have been recording our time and effort on COVID. They wouldn't let us do that because we weren't being paid out of the COVID grant. So I feel like we got put in a hard place by the feds and by our agency. And if we have that type of an emergency again, I'm not going to agree to do it the same way because they had so much money and they wouldn't hire staff, and they just kept expecting that we would do our regular jobs and we would do a full-time COVID job as well. And never imagined that it would last into 3 years. I think everybody thought, 6 months we'll be done with this, and it wasn't done. The other thing that happened to us is that there was an active shooter event at our building. It was still during the height of the pandemic, so there weren't a huge number of people in the office. There wasn't an active shooter, but it was reported there was an active shooter. So the staff are going about their day, and the SWAT team comes running through our floor, telling everybody to get in their offices and hide and get under desks. And 3 hours went by before they were able to come out. People have not gotten over that trauma. It doesn't matter there wasn't a guy with a gun. They believed for 3 hours they were about to die. And they have not, we've had counseling for them, and it doesn't matter. People remain traumatized from that event. They don't want to come to the office. And so that put more trauma on top of people already being overstressed over COVID, not just at work, but in their personal lives. I mean, everybody's suffering from mental health issues. So I see the staff now as more fragile than they have ever been. People blow up about things that they didn't used to blow up about. We have had more grievances in the agency than we've had in my whole history of being there. I had never had a grievance, in my unit in 30 something years. And then there were like 3 of them in a year. And that's stressful for the supervisors. It's stressful for the person filing the grievance. It's just, people dissolve into tears in my office, a lot more than I expected when I took this job as director. I said, I had no idea there'd be so many crying people in my office. And, I really reinforced with my supervisors this year. I said, I want everybody to have an interim evaluation, because come at the end of the year, I don't want 5 people crying in my office because they didn't know what they were going to get on their evaluation. And it's supposed to be optional. I made it mandatory. I said, people need feedback. They need to know, they need to have an opportunity to improve. So I guess my whole message is that people are still very fragile, and just trying to figure out how to help them so we can all move forward and do our work.
So in terms of the wellness question, the only thing I would say is what I've learned is, it's nothing revolutionary, is that wellness means different things to different people. So that's kind of the challenge, I think, when you have a big team, is they get to define wellness for themselves. Some things we can do and some things we cannot. So, and I'm the same as you. I always tell people to take time off. Like, there's nothing so critical, whether it is people who tell me, oh, I can't meet during this. And I always say that, like, are you picking up your kids? Are you getting your kids? Because that's sacred time. And I don't schedule meetings. I was like, block your time off appropriately. Don't make accommodations for me just because I'm the director. But it's tough because it means different things to different generations, to different people in different ways. And so it is not a one size fits all, depending on how you identify generationally, racially, ethnically, your own culture, the place that you came from, your training. It's just so different. And so it's tough, I think, to have one wellness. I think there's many ways of wellness.
You're completely right. And I love that you said that too. I do with my staff for wellness, we make jokes, we laugh a lot about hard situations, but I tell them, and I lead by example, always on your calendar, make sure you have your hour lunch and honor that. It's okay. And your 15-minute breaks. I'm like, have it on your schedule. You take it, it's there, honor that.
I will say, so NASTAD is very pro professional development. It's very pro wellness. It's very pro work-life balance. And I have noticed that even modeling it myself, even saying it repeatedly, even as an organization blocking off times, to call it quiet hours, meaning don't have any calls, don't have any meetings, we still have to beg staff to take time off, to have lunch and not work and eat at the same time, to not feel guilty about being on vacation. And I just have to admit that remains a struggle constantly. And we have to just keep layering on different ways to reinforce to the staff that, no, we're serious. You're not expected to, on Friday afternoons, you're not expected to do any meetings or that's your time to read, to get caught up, to do something that you just need to do to close out the week. Is that a challenge that do we have the same challenges in the health departments as well?
Yeah,
Very much so.
It's the precedent culture. It comes from the precedent culture before COVID of a very American way of thinking. If you're not working during lunch, if you do take a time off, oh my God, then you obviously don't care. And in how many years I've been working? Since I was 16. So 17 years of working in different states and different realms. This is the first time where I have had a place that we talk about this and we honor this and we honor our lunches. So just for that perspective.
I am a big believer in vacations. I used to take month-long vacations. I'd have to save up a lot of leave, but I would go for a month. It would be awesome. I'd come back because my team would have handled everything. And I have a couple of unit managers who, they're on vacation and they're on email every day. And if one of their emails pops up, I call them and say, shut down your email. You've got to stop. I said, you were so stressed out at the office. I said, your stress level's up here. I said, you've got to take this time. They don't want to do it. And it's all going to be waiting for me. I said, you know what? STDs have been around since biblical times. They will be here when you get back from your vacation. Unless someone is dying today or needs medication today, you don't have to handle it and you can find someone else to do it. Being in a big organization, we should have enough people to cover all of that. The challenge is that if you don't work through lunch or if you don't stay late, then there's stuff that doesn't get done and there are deadlines that still have to be met. So it always sounds good that I'm not going to work through lunch or I'm not going to do this or that. But, you also have people you're responsible to who don't seem to have a very good concept of what we do on a day-to-day basis or the volume of work. So it's always a balancing act, but I really do try to get people to take time off because I think they come back better.
Well, and this goes back to the unspoken part. So if our employees can't take an hour lunch without working and complete what we're asking them to do, well, then are we asking them to do too much?
And one of our biggest challenges is that we can't get FTEs. We actually have the money, but about half of our work staff and 67% of our Ryan White staff are contract employees, which means they have no paid time off, sick leave or annual leave. So when we have a state holiday, they don't get paid for that day. So we try to flex their schedules. They can work some more hours here or there, or if they can telework, they're allowed to. But how healthy is it for people who are not short-term employees, but long-term employees to have no paid benefits? So we've got people who are helping others enroll in health insurance, but they don't have health insurance. And, that just seems so wrong to me from an equity standpoint. And, we have begged and begged and begged for FTEs. This isn't specific to us. And of course, they want smaller governments, so they don't want FTEs. And you've got many unfilled FTEs in the health department, but no one will give them to us. I mean, this was a finding on our Ryan White site visit, and we still can't get any traction with the powers that be. They always promise there are going to be FTEs, but there aren't. And that creates haves and have-nots within the workforce, and it makes people resentful. We had things like, employee assistance program, if you need counseling or whatever. Well, guess what? It's only open to you if you're an FTE. So we had things like the active shooter event, and we want some group and individual counseling sessions. We had to push pretty hard to get them to allow the contract employees to benefit from that and participate. We're like, they were in the building too. They were impacted, and their temp agency isn't going to do this for them. But one of the things we've done is just to try to create opportunities. A lot of the contractors don't understand the state system. So when the jobs do come open, that you've got to meet the minimum requirements. If we don't see it on your resume, you don't get into the slot for, qualifying for an interview. So I have done a number of trainings for the contractors, like how to go from a contractor to an FTE, like how does the state game work? How do you fill out your state application? What are we looking for? What do these KSAs mean? Here's how we screen applications. Here's how to do an interview. And I have also offered to mentor these staff, to revise their resumes with them, and to do mock interviews with them. And several staff have taken me up on that. And I said, if it isn't your supervisor who's going to be that mentor, find another mentor within the health department who will help you with these things. And that's been a positive thing that we've been able to do.
I have a question that was raised to me, and Jessica, I think you've talked about professional development and kind of how Colorado manages that. But I had a supervisor group who wanted me to help define a policy or a procedure on how we manage professional development, in particular as it relates to if you have to travel for a conference, right? If you're just doing an online training, that's never an issue. And even if it's got a cost, we just cover that. But it's these traveling to conferences, and they wanted me to come up with that. And I was like, I'm so not going to do that. I mean, I'm not going to do that. I think I support us coming up with some ways to achieve a balance of this. I don't want to be the one, though, that's going to decide that. So I'm curious if folks have ways that they're figuring out, how do we make sure that everyone who needs, wants, and could benefit from professional development, particularly as it relates to travel, right? Because now we can travel again. And so, and it also comes down to funding, right? What's your job? Are you covered by rebates? Well, then everybody gets to go. If you're covered by, PS 18, probably not, right? That's not how I want to approach it either, right? So I'm interested in ideas about that.
Yeah, I think it's a good point. One thing we've tried to separate out is the funding source from the person who's traveling, because we'll try to figure it out on the back end. We try to be equitable, not achieve equity, but try to be equitable in terms of if someone has gone to a conference in the last 6 months, are we letting them go again? And so what's the purpose of it? What's the learning? And even, I should have gone to NCSD, but I didn't feel like that was equitable for me to be at NCSD and then pop up here. So I had other staff represent me at NCSD. So I'm trying to model the way, but they put in a form about what they hope to learn and achieve. We also asked them to put in abstracts because we've done great work. Doesn't mean if they don't get an abstract, they can't go. But we ask them to do that. And then we say, do you have a funding source in mind? And then we figure out the funding source on the back end with our fiscal team, which is helpful because you're right. Just because you put it into a grant, and a lot of people were like, no, it's in my grant. And I was like, but you went twice already to something. That's a non-starter. Somebody else on your team gets to go. I don't care that you were named in a grant. That's not how it should go. And so we try to do those kinds of things to be equitable. The other thing I wanted to mention, since I have the mic and then I'll stop, is that we do Strengths Finder. So all of our team have done Strengths Finder, and we've trained 2 times with a person, one on individual strengths and then one on how to leverage team strengths. So all the teams met together about understanding, if someone has more strategic and not execution. Oh, interesting. We can tell that, right? So how do you pair them together to really leverage their strengths? So we're trying to build a strength-based culture.
I'm also though curious in your community agreements, you said the staff, did that. What was your process to get them to come to those agreements? How did they get time?
I did lead it because I led it before in another group. So I asked them what brings them to this work and what do they need to be successful in the work? And so they came up with a bunch of things. It was first the employee engagement group. And then this time we passed it through our resilience champions, the trauma-informed group. So I asked them those 2 prompting questions, and they kind of, then they end up categorizing themselves a bit. I got the first idea from the National Equity Project, which is out of the Bay Area that does work on educational and health equity. So they did that. And so I used it in a similar way.
Walk to that table over there to see if any of them have anything to say.
Yeah, I had a question. If anybody, kind of going back to wellness and coming to trainings like travel, I know a lot of with government and these things, our staff get reimbursed later after the fact. And I always worry, like, do they know that they're going to have to put a credit card down? Are they going to have to put the $300 deposit down? Do they even have that money to do that? Are they going, do they have to pay for their own lunches? And then I know in a lot of states, it takes about 3 months just to get reimbursed. And I always worry about my staff if they travel. Do they even have the money? Is this going to put them behind? So I'm wondering if anybody has, can't give them a credit card, can't give them, any ideas on how to make sure that. Okay, we don't.
We have state travel credit cards. However, you've got to pay that money back when it's due, when that bill comes, regardless of whether you got reimbursed or not. We just went through a new financial management system. They turned over everything. I'm sure they used COVID money. We've got all new systems for everything. And people weren't getting paid back for like 4 months, especially like DIS who travel every week. So that bill was getting bigger and bigger. And a lot of staff don't want the credit card because if you don't pay it off, then you're penalized and the state takes it away from you and you've ruined your credit. But meanwhile, you haven't gotten your reimbursement. So that is a challenge for staff. We have sometimes been able to prepay things like the hotel rooms, like we'll put it on a direct bill to the health department so they don't have to pay the bill. Some hotels won't accept that. We used to have that happen a lot with like USCA and stuff, and the conference hotel would not let us do direct bill to the health department. So it was a struggle for people to come up with over $1,000 just for their hotel room.
I think Clover and then Tim took the mic from me, so.
I was just gonna say, we started giving the advance, like the meals and incidentals and the luggage fee and all that stuff in advance, as opposed to after as a reimbursement, so that you were going with money already. And then we pay for the hotels before they go, so that we make sure, like, we send the card form, we send them with the form, so that if there's any issues, it's late, your flight is delayed, you can't get anybody in the office, you have the paperwork to show that we paid the hotel room already too. If you don't have a card that you can put the hotel room on, because you usually want to charge $100 or something, like if I'm with you, I'll use my card for the other room. Or like another manager will use their card for the room, and then that comes off back on our travel reimbursement if, you know, something is charged to it. But just, we used to always do reimbursements. Everything was, you had to submit all these receipts and get it back. Well, you're only gonna give us the meals and incidentals at the government rate. So that's what you're gonna give us either way, regardless of what we have. So just give us the money in advance. And they finally listened. And so that works out well for people who aren't used to traveling or may not have that money up front.
Thanks.
So Tim McCormick from Hawaii. I'm not really going to add anything, I'm afraid, to this discussion, but I wanted to go back to the wellness question. So we have vacancy rate of over 35%. So everybody is covering multiple positions. You know, I definitely talk a lot about setting good boundaries and not working long hours, but somebody made the point, at the end of the day, there's a ton of work that needs to get done, and it may not be about kind of life or death in this moment, but you know, if this contract isn't in place, we're not going to have syphilis screening services next year. And so the reality is, you know, the people who are really putting in the extra hours, like, I kind of need to have them keep doing that. And, you know, I really hate saying it because it goes against everything I know about wellness. But I do think that one thing that's been really helpful is to be having the conversations with staff, bring up issues of burnout and wellness. And, you know, we've done that a lot more in the last couple of years than ever before. And just kind of acknowledging that is a real worry and that there's not a ton we can do about it kind of right now. I think that's just been helpful and validating to people. We have done things like brought in somebody to do a session with staff on mindfulness and trauma. And it was basically just kind of a mindfulness breathing and a discussion about why it's important. Staff loved it. You know, they want it more often. I've completely dropped the ball because there's nobody who has time to take it on. So I just wanted to, I'm sorry, but express that frustration that I don't really know. You know, we know what needs to get done, but we don't have kind of the human resources to make it all happen and keep all of the other balls that have to stay in the air.
So to add to that, you know, this boils down to time management and also prioritization. I think we have to be mindful and be honest with the staff that, you know, we can't achieve everything in a single day. Heck, I wish there were more hours in a day, but that's the reason why I go into work on Saturdays, usually by myself, because I get things done. You know, I don't have all of these telephone calls or emails bouncing as I would on a Monday. So I think prioritization, time management, I think we really need to go back to the drawing board and have those management and leadership 101 to see where we're at. And I think that would definitely help us with the staffing challenges. As far as the travel, we too in Guam have the payments made in advance. So you can choose between receiving the paper check or getting it deposited directly into your account electronically. So those are the options. Also, you know, off the record, if you have multiple people going on a trip, you can even encourage them to bunk together if they can save it, you know, some money on accommodations or even like food. They can share the costs.
So can y'all hear me? So we named this building a more perfect health department. We have about 14 minutes left, and I want to see if I can get some information from you around that and also challenges. So here's the question. My job is to offer technical assistance around organizational excellence. That's literally that's my job. So as you're thinking about building a more perfect health department and you're thinking about the challenges that you're facing, what type of technical assistance would you like to see us pursue in the short term, given the conversation that we've had today? And if you don't give me any work, my boss is right there. I'll just tell her that I don't have anything to do.
Okay, Clover from DC again. And I'll give you the mic. I'm just gonna say it's a tough question because there's so many things that are happening that are outside of our locus of control. We have a 35–40% vacancy rate, but we also have 50% of our health department has been there less than 2 years. So we have a bunch of people who are new to our public health department. Some of them have worked in public health, some of them haven't. But then we also have a lot of turnover because we're required to be in the office. And we know there are lots of jobs that are 100% virtual. We go in the office 3 days a week and we telework 2 days a week. And then the people who are there, who've been there a long time, or for longer than 5 years, I feel like are on the edge of burnout. And so I can't tell you what we need because I feel like we don't even have time to think about what we need because we're too busy trying to do and keep things going and keep our reports in and, you know, all the things that we have to do, that we don't even take the time right now, at least, to reflect on what could help us. Like, I'm not even sure my staff would feel if I said, okay, well, we're going to have some technical assistance or some capacity building or a session or whatever. I think they would rather try to get their work done. It's just the reality of where we are. You know what I mean? I think they would feel like, you know, if I have to prioritize which one, right now, we just got to keep everything going. Yeah, it's kind of where we are. I mean, I start the meetings with a question like, how is everyone? Like, let's just take 20 minutes to regurgitate like all that we're feeling and we've been through this week, just so it's heard and it's out there. And if there's something low hanging that I can fix, I work to do that. But a lot of it just is what it is. And like, even like we try to have little things like, let's all leave work at 3 so we can go to happy hour, right? That'll just be something fun. But inevitably, there are 6 people who still have something that needs to be done and they don't leave till 4:30 and they just go home. You know what I mean? It's just not, I think the people who are there because they love what they do and they believe in the mission and they believe in what we're doing and trying to help our residents. But right now, that balance is tough. And so, I don't know how else to describe that. So I'm sorry, I'm not giving you something tangible. I'm more giving you the why we haven't asked for anything than the actual. Okay, all right then. Well, there we go. I spoke from the heart. Thank you.
I will add on to that. And this is part of like, yeah, I'd rather get my work done. That's always how it's been. So I think especially we're doing a lot of new things in Arizona and trying to catch up with the rest of the country. And I know from my subrecipients, it would help, and us at the state too, is like, our programs, I think we live in a new world. So, if y'all had and maybe you do, have this guideline of like, this is a sustainable program looks like, and here this is what it should look like. You should have this, like really lay it out there, like step by step, and then have one yourself or somebody else on a team, be like a project manager or something for that organization, and to follow up like, hey, if this is one of your goals, we are going to work with you. We're going to go work with you to achieve this. And so because we might not have the capacity or the capability, especially if we're hiring new staff who are new and they're like, oh, this is my first time here. Okay, well, this person is a mentor. If you had more mentors or somebody who's done this work or they were like this, like we have clinical quality manager. Okay, well, as a clinical quality manager, this is what you should have. And that is a part of work, and we're achieving something, and they're not alone on it, because there's only 4 other people in the health department and this is a new thing. So that would be my one suggestion of that. Sorry.
Um, I'll talk while you're getting the mic. One thing that I think is helpful, quite frankly, is when I come to this meeting and I get to talk to my peers from other states, because we don't really have peers within our state if you're the director. So my peers are here at this meeting, and this is always extremely therapeutic for me. I usually come in on day 1, I'm like, oh God, I got so much to do. And like by day 3, I'm like, I love these guys so much. And so-and-so's got a 35% vacancy too. Maybe it's not me. Maybe we just don't suck. Maybe it's just, this is hard. So I have to say opportunities for directors to get together and talk to each other, or if it's other staff, if it's the drug user health staff, or it's the Ryan White Part B staff. And I know we have all sorts of meetings with NASTAD. They're usually policy focused or getting the work done focused. But if there was a support component to that, I think that would be really amazing, because this has always been a great support for me. So I would say that.
Preferably during happy hour. NASTAD sponsor that one. No, so one thing that I was thinking about, given the challenges with staffing, right, the shortages and whatnot, maybe we can, as a program or department, hone in on those processes that should have been done by that vacant position, and do like some type of business process improvement, like just assess. Find out what process really needs to be improved, go from there. And that could be that one goal that the program or the entity can focus on for the meantime, that little project, and then, just do more skills building and all of that management and time management 101, and add all of that. And I really think another component that needs to be included is we need to get HR on board with all of these things, because we have all of these challenges. At least for Guam, we have been absorbing a lot of the HR challenges because granted, HR couldn't even keep their own staff. So what they did is they decentralized the HR process there, or the system there. And now the programs are handling more of the HR processes. Like we're trying to put together the recruitment packets. And then we're also the same people that call the individuals to schedule them for interviews. We come up with the questions for interviews and do all of that. So I think, in jurisdictions such as Guam, where it was decentralized because of COVID and everything that happened, I think we need to go back to the drawing board and centralize some of these processes.
I think this, how do we prioritize our work? This has been brought to me by a couple of my direct reports who are managers, and it's really hard, right? But I think if there were some kind of a tool to help, how do you, you're not going to get it all done. So that's just it. So they look at me and go, but what's your priority? I was like, well, I don't know. What's your priority? So I think if we had some kind of a tool that we could go through in some, I don't even know if that's possible, but some way to prioritize the work so that people don't feel like they failed that day. Because I think that's really the goal. Did you feel successful in something that happened for you today? And if so, then let's call it a win, And so I think that's, to me, that would be helpful, because I've struggled to help my team prioritize their work. I think the other thing I was going to say was, while I agree with everything Clover said about, sorry, we can't really help you with this, but is having best practices that are working. I mean, hearing from Colorado, hearing from Arizona, hearing other things that are going on in Guam. I mean, that's helpful. So even if it's just, I think we have to set realistic expectations, though, on ourselves, just as we do on our staff, right? I can't change the world, but there might be 1 or 2 things I'm really going to need to focus on, and that could make the culture, the work, more pleasant. And so it might be an easy one, right? I'd love an easy.
I was
Please
gonna.
give me something easy.
I was just going to say one quick thing, Beth, in response to what you said is I used to have I have a bracelet. It's not on me right now that says that my old boss who got from Yom Kippur, which is you're not free to ignore the work. You are not responsible to finish the work. And I share that. I wear it a lot, like for staff, because I think that's a beautiful sentiment. We're not going to ignore it, but you're not responsible to finish it every day, every year. There's other people that can support you to do that.
I have a comment from the chat, but I first have to say the temperature differential between this part of the room and back there must be 20 degrees.
That's why everybody on the platform is always freezing.
Oh my goodness. Anyway, here's a comment from the chat from one of the virtual participants. I think help, quote unquote, selling wellness is a priority to a wider group of folks, both within jurisdictions as well as to other jurisdictions. It seems that it is largely the same jurisdictions are the ones who show up to these types of conversations. And then also best practices, maybe in a story format. I don't know, just thinking out loud. And that was shared from Holly.
Right. I will say, so one thing I have started doing, and those of you on the board know this, but those of you who are not, might not, is I do calls with a couple of colleagues, about every 3 weeks. And there's no agenda. It's not really about the work. If we want to talk about work, that's fine. But if you want to just vent and let it out, and because there's no confidentiality. I don't know anybody. I don't even know, right? Who works for you anymore. And so it's been a real lifesaver for me. I don't know what it's been for them. I hope it's not been, oh God, that Beth, she really needs to get some professional help. Pay someone. But it's been really nice. And I think that's something we're wanting to, think about in kind of as we move through this year of what are some of these supports for leaders and in all parts of the health departments that we work in, because you're right. The only people who really understand what you're going through is someone else who's also going through that. So.
Really quickly. So maybe that's what you could do. You could have like an affinity circle that we can join monthly as health department leaders, where we can have that camaraderie with each other. I too have it with different people, Elaine, Sarah, like different people who we get together on our own. Like we have scheduled calls or in-person meetings, but maybe if it was something that was open to like all the health department leads to share, like open, like come if you want, don't.
Right, not mandatory.
Right, but share what you want to share. What happens in Vegas stays in Vegas. And we have a place to vent with people who understand what we're going through.
One of the great things about working at NASTAD is the perspective that I get from throughout the year, so many different meetings that I get to be a part of and listening to so many different of the jurisdictions. So I actually got this idea for this breakout when we were at the fall board meeting where Beth and her peers were discussing this topic and they spent an hour on it. And I was like, well, let's take this topic to the annual meeting. And now I'm thinking, we have the TA meeting in October, which is another audience of folks. How could we continue this conversation with that audience? And what I've learned is that, folks may not call it organizational excellence, but there are quite a few health departments doing quite a few things that we would consider to be within that realm. I could just talk just about the trauma-informed piece and the number of health departments that have adopted things from the toolkit that have helped us to develop it. And so I do feel like, to Beth's point, I feel like maybe folks don't feel like they necessarily have that they're ready to like be up there with the best practice, but I do feel like the membership are doing quite a few things that we can lean on. And to Clover's point, an affinity group, like what does it look like? That's the piece that we're figuring out, but I do think that there's quite a few successes already to be continued. We are right at time, so I'm going to stop here so you can enjoy the break. And then hopefully I will see you all later this afternoon at the reception. Thanks for coming. And thank you, Beth.